Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. Welcome to our Friday's Q&As. This is a segment where you get to ask me questions and I get a chance to answer it for you. So if you do have a question for me or questions, my email is below in the description box. It's basically info@drzphd.com. Make sure you just keep it short and to the point. Email it to me. I put it then in a folder with all of the other selected questions. And I randomly go through the folder and select 4 to 5 questions for the segment. Before we begin, if you have not had chance yet to subscribe, make sure you do subscribe. This way you are helping me, you're helping everybody else find this content. If you don't yet follow me on Instagram, go ahead and also follow me on Instagram. And also there are a lot of links below to copy of my free book, to connect the circle of trans womanhood, to get a copy of a free PDF checklist to get started on your transition path. There's a lot of goodies down below, so check that out below as well. Having said that, as always, I have blocked out everybody's name for privacy reasons and email addresses and only kept questions. And I selected randomly 5 questions for today. Timestamps are going to be below. Without further ado, let's get started. First question for today. I am an adult currently living with unaccepting family members. I'm also currently on disability and currently can't afford to move. So how can I deal with all of this and discover I fit under the trans feminine umbrella in the meantime until things change? P.S. I'm currently in the state of Texas, so you have an idea of how things are for me. Yes, unfortunately, I do have an idea. It is very, very difficult in a lot of states, parts of the United States now, for sure. A lot of the other parts of other country, for sure, very, very challenging without a doubt. So what can you do if you're living with family members, they're not accepting, and there's really not that much you feel like you can do, because if you were to start expressing yourself outwardly, sounds like you may get some kind of pushback or some kind of criticism that is difficult for you to bear. So what can I recommend for you to discover if you are actually trans femme? Because it sounds like you are exploring your gender identity. One of the things I recommend for anybody in a situation where you are in a surrounding or environment, maybe you're not even with family members, but you're living in a place where you really feel like it's unsafe for you to express yourself, but you have to find a way to figure out what is your gender identity, whether it is trans femme or non-binary or trans masc. One of the things that I recommend, if expressing yourself is unsafe in any shape or form, is to start journaling practice. Yes, journaling. Journaling is one of the most powerful things to connect to ourselves. There's a reason why every single therapist on this planet is going to recommend journaling to pretty much every one of their clients as part of connecting to themselves. When we journal, when we actually sit down and start having a dialogue with our deeper selves, we discover things about ourselves. It's one thing to have things in our headspace, and especially when it comes to gender, to have things in your headspace, to keep thinking about your gender, to question your gender. The challenge with keeping it all in your head is that your head is going to try to solve a problem, and your head is going to go back and forth, back and forth, back and forth. It's going to be stuck in a circular loop of information coming in, information dropping out, and the more you expose yourself to information out there on the internet, the more confused you might get. So getting out of your head, like I said in one of the videos, having somebody to talk to, having a soundboard is one of the best things you can do for yourself. And if you find yourself in a place where you can't start expressing yourself as a way to explore your gender identity, start journaling. Wake up in the morning, get yourself a cup of coffee or tea, whatever your beverage of choice is, And just start writing how you feel, what makes you confused about your gender, what makes you wonder something is going on, how do you feel throughout the day, how did you feel the day before, what happened to you, what happened when you were gendered the previous day, what did that experience tell you about yourself, what feelings arose. Once you're going to start writing down and getting your thoughts out of your head and onto paper, what's going to happen is you're going to have aha moments. In the very least, if you can't do journaling, can you then at least engage in therapy in your area? Can you see a therapist, a gender therapist, or any therapist so that you can start going to why? The sessions with the therapist are private and confidential. Also, it opens up space to sit across somebody who can start questioning you, who can start bouncing off the right questions for you to consider. So I really encourage for you either to seek therapeutic supportive services if you can, or in the very least, journaling. That's going to go miles and miles and miles for you. I do have a class. I have a class on is it gender dysphoria. It's a very intensive class. It's an online class with a very detailed assessment workbook. You're welcome to see if you would like to purchase this class. All the links to my products below. It's a great class because it walks you through trying to figure out if you are experiencing multifacets of gender dysphoria. If you already know you have gender dysphoria, or if you're just trying to find out your sense of identity, again, just journaling practice is going to be very helpful. So that's what I would really encourage for you. But good question, and you're not alone in being in a position in place where you just can't explore yourself. Question number 2. I'm writing down now time for timestamps. So question number 2. I am BDSM lifestyler. Sorry, let me take a sip of water. My throat is getting a little dried up from video recording I've been doing today. I'm a BDSM lifestyler. I have exclusive masochistic sexual interest and am aromantic. I'm pretty sure that it's a defense mechanism from the fact that my mother is a lawyer who I overheard talking about traumatic details of abuse to other adults as a child so many times that it altered the way I think. Okay. Should I be worried that my gender identity is also a defense mechanism? Does it even matter and affect the way I should proceed? How common is BDSM identity in trans people? This is a really good question because I have a ton of people who have I wouldn't say like an overlap, but a lot of trans people who are also in the BDSM lifestyle. For starters, I want to say is that I personally don't see any correlation. BDSM lifestyle is a sexual preference that one might have. Tons I worked with in the past. I worked with tons of cis clients who had that lifestyle. It's just a sexual preference. So I just want to be clear is that there is no correlation there. It's not like trans people necessarily are the ones who lean more toward BDSM lifestyle. That is absolutely not true. So let's be clear about that. So you yourself convinced that your exclusively masochistic sexual interest within BDSM lifestyle, and also you being aromantic, is a byproduct of defense due to childhood upbringing. I'll leave it up to you. That's something that there's no way to unpack in this question, whether that is true or not. But if you feel that is true for you, then that is your experience of it. Now you're wondering whether you should be worried that your gender identity is also a defense mechanism. You're not expressing in this question what your gender identity is. I'm not seeing it here. I'm assuming your gender identity is something other than your assigned gender. Could it also be a defense mechanism? In my experience, yes. However, I want to be very clear, I have seen people step into identifying with gender other than the one they were assigned at birth. In my 20 years, I have seen that happen extremely, extremely rarely. Because as a defense mechanism, usually defense mechanisms that have strong ways of altering our sense of self. For example, dissociative identity disorder, where personality tends to fragment and split into what used to be known as multiple personalities, is a very it's a very specific defense mechanism that doesn't just occur through experiencing life. It occurs through experiencing severe, strong exposure to trauma. And the same thing with taking on gender identities that is not the one that is other than the one assigned. I've seen that happen. If I were to now look back, two comes to mind. I'm pretty sure I've seen it at least happen twice. It's very, very, very rare in my experience. Both of the cases where I have seen and worked with one individual also had, apart from that, dissociative identity disorder and a history of severe ongoing sexual trauma. Severe ongoing sexual trauma. I want to be very clear because today there's a lot of people who are looking for a way to exclude trans identity as a formation of identity one for various root issues causes, and to point out that people who exhibit transgender identity all have history of trauma, which is define trauma. First of all, like, what are we talking about here? How are we going to differentiate which trauma I'm referring to? Because in my experience, all of us, every human being on this planet, one way or another, has experienced some form of trauma. Life is traumatic. But there is a difference to severities of traumas we experience. I'm traumatized every day by news I see. I live in Los Angeles. I'm traumatized by what's happening today to our communities and how people are being clutched from their kids and being deported. That is traumatizing to me. Am I being traumatized to the extent where I'm starting to split and develop dissociative defensive mechanism, or where I'm starting to use another form of gender identity of my defense? Of course not. So I want to be careful that yes, trans people undeniably are going to be experiencing especially trauma that is going to be stemming from the world, not the world is pushing messages onto them, onto you, that you're not welcome, you're not accepted. That is going to be traumatic. Is it the type of trauma I'm referring to here that then is warranted to utilization of defense mechanism? I would say no. So I'm being very mindful here how I speak about it, because I don't want people to hear this video and jump on a bandwagon that, oh my God, trans people are only trans because of the trauma and it's not really valid trans identities. That is not true. Having said that, it happens very, very, very rarely. And to really find out if the root cause of your gender dysphoria, if the root cause of your gender identity is trauma-based, is it stemming from there, will take sitting down with a therapist and will take a historical collection of your development, historical collection of just overall your history to really find out what's going on. So that's, yeah, but very, very rarely it's possible. Now, your other question is, does it even matter and affect the way I should proceed? Does it even matter and affect the way I should proceed? I don't know what you're planning to do. What do you mean? What are you planning to proceed with? So it's hard to answer that one. How common is BDSM identity in trans people? to me, BDSM is not really an identity. It's a sexual practice, at least that's how I see it. It's a sad, and there's so many within BDSM community. It's a lifestyle. It's a practice. How common is it? Equally as common as it is in general public. And it's not all evenly across the board. There's lots of trans people who are not into BDSM at all. And there's those who are. So again, it's not that it's super common. It's equally just, it's a sexual lifestyle. So there's tons of people in the world who are into BDSM. Tons. So I wouldn't. And by the way, I want to also finish wrapping up this question by saying that there is absolutely nothing wrong with participating and having BDSM as your sexual preference. Nothing wrong with that. BDSM is probably, if you are engaged in it properly and educated and understand, consent is cornerstone of BDSM. There's far less consent in hetero practices. Okay, let's just put it that way. As a woman, I know. And I feel like consent should be, an understanding of consent should be educated across all sexual practices. So I'm just going to finish up on that. But yeah, good question. And some of these questions you're asking are like whether you should proceed. I don't know. Not sure what exactly you mean by that. But good question nonetheless. Question number 3. I am assigned female at birth, 56-year-old trans man. My big breasts are the source of most of my dysphoria. I'm so sorry to hear that. That is, having a big chest and identifying as trans masc, if you don't resonate with your chest, it's a tough one. And no binder can hide them. Yeah, and even if the binder can hide them, it can really cause to health issues. And just really uncomfortable to wear a binder. I started hormones but cannot find a Medicare plan that covers top surgery. I am disabled on Social Security disability income and cannot pay $11,000 for surgery. Any ideas on how I can access grants or find surgery on a sliding fee scale? I am desperate. Thanks. First of all, my heart goes out to you, and my heart goes out to all of you out there who are in a similar type of position. I think this is one of those, the reason why when this person emailed me this question, I decided to take it into the folder for Q&A is because this is so common. The lack of accessibility and affordability for gender affirming surgeries are a real problematic issue. And for a lot of people that have very severe body-specific dysphoria, it can be really, really challenging, and it can be really, really difficult. Especially when you are taking hormones, you're starting to masculinize other aspects of you. And the chest is such, predominantly in our society and culture, it is such a feminine artifact that it can become really, really challenging. So this is hard. And the reason why I included this question is because I also want all of you who are watching this, help me out here and help this person out here. I personally not familiar with any grants, primarily because the population I work with, a lot of people that I work with has insurance. I'm also in California where Medicare, well, at least up to this point, my God, Medicare and medical for sure has been covering all of the surgical procedures for gender affirming care. One of the things that I had my clients do that has been helpful to them that I want to share is to create a GoFundMe fund page and just distribute it on social media. And by the goodness of the heart of a lot of people, try to collect as much funding as they can. If any of you watching this know specific grants, I know, for example, there's specific organizations that will give out binders for free, but that's different than grants and scholarships for gender affirming surgery. If any of you know, please do comment below. Do share your information below so that this person watching it can see if there's anything like that there. But GoFundMe page is one of the common ways that I've seen a lot of people do. I had clients who have done it too. Were they able to collect all of the funds? No, but they were able to raise at least some sums. It is really, really hard. This is really, really hard. Not having accessibility and not having funds for things is one of the hardest obstacles for a lot of folks out there. And I really wish there was, and I really wish, it's really hard, really hard. So my heart goes out to you, and if anybody knows, please do share information below. Question number 4, backdrop. I have mostly felt comfortable in my male body, and we're presently okay. We're generally okay with it for most of my life. I adore beautiful women, so do most men, okay? But I started putting on female clothing, heels and lingerie, etc. even before becoming a teenager. I believe this was just my developing sexual libido with a kink for the feminine towards an orgasm. I said it fine, towards an orgasm. Up to my 40s, even through married with children, the so-called habit or fetish became something I often resisted and aborted often, but it always came back. Now it has become a strong desire to develop breasts and a female body on top of loving to cross-dress. The process has been progressive over the years. Question. So, can trans femme identity start with some feminine fetish/pleasure in earlier years and transform into a very strong desire to be fully female later? Am I thus trans? Yep. Yes, it can. Absolutely can. There's multiple routes that tend to lead to development of transgender identity. The most common one that across the board majority of people are experiencing is what I would say biological organic route, meaning you're born and you have one chromosomal assignment, but neurologically the way your brain organized, the way you see and perceive yourself is of a different gender. And usually people who have this kind of organic biological, for lack of better words, tend to experience the onset of gender dysphoria pretty early in childhood. Pretty early they have a sense something is off. There's, like I said, many routes. I should probably do a video on this because I did a very intensive presentation for university on this. And one of the routes is also sexual preferences, sexual lineages. And it happens pretty much the way you describe it, where an individual starts to develop a sexual enjoyment out of feminine items and also feminizing early on. And then because they establish a mental linkage to that as something that feels good, something that's pleasurable, you continue to engage in this practice and you continue to engage and you start forming not only habit, but you kind of start forming a mental connection that's your primary way to sexually stimulate yourself, primary way for you to achieve an orgasm. And that continues in the young adulthood and then later in the older adulthood. And the more a person has this as a sexual preference, the more it continues to feel good. Just like any other sexual preferences that we have out there. We all have certain sexual practices, sexual positions, sexual way of expressing ourselves that predominate over everything else. And chances are because we have developed also some kind of linkages to them. And so this can continue. And one of the reasons why a lot of people ask me this, but why then it then sips into identity, right? Sips into any kind of conflict with assigned gender. Well, it doesn't, not for everybody. For a lot of people, it just continues to be sexual preference, and they maintain a strong core identity as man. They identify as man, they enjoy being man, and so for them, they start calling the sexual preference cross-dressing for sexual pleasure. And for some people, it starts to sip into something else. In my experience, one of the main reasons why it starts to develop into transgender identity, or starts to move you away from your assigned gender identity toward another gender identity, is because of repetition of cycles of shame and guilt. Oftentimes, this happens to individuals who are older, and I think you mentioned your age. No, the other person, the other question mentioned age. But usually I find that people who are 40 and up, who are wondering now why is it that their sexual practices are turning into identities, this happens very commonly to them. When you're younger and you grow up in a time, and I talk about this on channel under many, many videos of is it cross-dressing, is it trans identity? When you're young and when you're growing up in a context where feminizing for sexual pleasure is a taboo, it's still taboo, but way less so for younger generation today. Younger generation today are more sexually open in their practices, so they're less likely to go through a cycle of shame and guilt. But for older generation, there was no normalization that this is okay. In fact, there was stigmatization of certain sexual practices as not being okay. So when you grow up and you're really young and you put on feminine clothes and it feels good, you get an orgasm, you may be confused why, but you're still not really in shame and guilt because you're still not tying this practice as being taboo. But when you become a teenager, and especially young adult, and you still engage in this practice, because of the context again, when you grow up, you're starting to realize this is taboo. Maybe you have friends and friends talk about their sexual experiences and none of them have similar practices as yours, and so you start wondering what is wrong with me. Maybe you start realizing that maybe you come across pornography and you realize that most of the porn is very heteronormative, and so you start wondering, well, what does it say about me? Why do I like to put on pantyhose and ladies' panties and get on a razzle and get sexual orgasm? What's going on with me? So what happens is a cycle of shame and guilt that breeds confusion with your core gender identity, and as a byproduct, it prevents you to solidify your sense of self. And the way it looks like is this: you maybe start fantasizing about feminine items, or you just feel higher sexual energy, you're feeling horny pretty much. So you get into what tends to make you feel good, in this case feminizing clothing. So you feminize, you self-please yourself, you achieve orgasm, and then after the release of orgasm, you start feeling shame and guilt. You're sitting there literally and wondering, why do I do this? What is happening to me? This is kind of not normal. A lot of other boys don't do this, so something must be off with me. Maybe I'm a girl, maybe I'm a woman. So you start kind of feeding yourself this narrative. And the more you constantly go through this, why am I doing it? What's wrong with me? The further you kind of step away from your core gender assigned self. So over the time, it may start to develop where, because you never solidified your assigned gender, you then start feeling much more comfortable with the feminine aspect of the gender and tearful lean toward trans feminine side. Very common. I personally think that that's just one of the roots of trans identity. I don't think that there's anything wrong with it. We have to understand, as human beings, we're very complex. We are multidimensional. And our gender identities are not statically fixed. A lot of things in life can alter and change our gender identities. A lot of things can lead to us to shift, right? The older I get, the less I'm strongly anchored in absolute woman identities. The more I'm just kind of like almost care less and start to shift and allow myself to be a little bit more all over the spectrum of gender. That just shows you we're not meant to just be very, very, it's very societally inflicted ideas, is what I'm saying. So I think that's, if that happens, that happens. That could be one of the reasons. Another thing that's very common is that people can have sexual fantasies, sexual practices towards feminization, and alongside also be trans. And a lot of times you won't know because you're masking over your possibility of you being trans by telling yourself, oh, this is just sexual for me, this is just sexual for me. And you're telling that to yourself all of your life as a way to kind of avoiding confronting this until something like this happens. So, like I said in one of the videos, when a person starts now thinking about having a desire for body embodiment of an opposite gender, in this case, developing breast, female body, yeah, there's now going on a trans, I would say trans identity is bubbling up. So that's something for you to explore. Because this is no longer just sexual practice for you, right? Again, sexual practice is, think about it, what happens in a bedroom. You do it, you engage with it, you enjoy it, and you're able to just walk away with it. And for the rest of your other part of your day or week, you are able to be aligned and comfortable with your assigned gender. So think about it that way. But really, really good question, a very common one. The recent video, just very recent video I did, is it cross-dressing or trans identity, touches on that as well. And there's some other videos there's a touch on as well that I encourage for you to look at, but very common. And finally, question number 5. I'm just trying to understand the many facets of dysphoria. I understand physical dysphoria. I'm more interested in the emotional aspects of dysphoria. I would love to look, act, and feel totally feminine. I want what women have. I want to feel what women feel, to experience life as a woman. I'm not always comfortable as a male. The thing is, I don't always feel this way. There are times when I'm totally fine as I am. So it is kind of a conflict of interest going on inside. Does that even make sense? It isn't constant barrage of emotions. Why not? Does it really vary in degrees that much? Thank you, Dr.Z, for the opportunity to ask questions and for helping people to find the information we need to navigate such a complex subject. Yes, the subject is indeed very, very, very complex. And you're definitely not the only one who's trying to understand multifacets of dysphoria. So, as you pointed out already, physical dysphoria is easier to put a finger on, right? It's easier to measure the pulse of physical dysphoria because we can viscerally feel discomfort and disalignment with some aspects of physicality, oftentimes with primary and secondary sexual characteristics. Emotional dysphoria is a little bit more different, and you touch based on it. Emotional dysphoria is has more to do with internal state of being. Physical is more external state of being, right? Emotional is more internal, but the two tend to overlap. They dance together because the physical informs emotional and emotional informs physical. A lot of the things you point out here, I want to feel like a woman, I want to experience life as a woman. I just want to point out that because I have a lot of people who tell me I want to feel like a woman. How do I know when I feel like a woman? Honestly, I just want to blur out there's no such thing. We're really talking about subjective perceptions and of how we feel, and then just layering them with gender. The difference between me, because the feelings really, if you think about it, they're really not gendered. We're the ones who are gendering them. If I watch Sunset with my husband, who identifies as a man and comfortable as a man, and I identify as a woman and comfortable as a woman, so we're two opposite genders, right? We're watching sunset together, and non-binary individual next to us watches the same sunset. We're all in awe of the beauty and eloquence of the sunset. We all may feel different things in a moment, or let me put it this way. Let's say we all feel the same feeling in a moment. We all feel this moment of beauty. It's a feeling. Each one of us. I feel beauty in this moment. My husband feels beauty in this moment. And the non-binary individual next to me feels beauty in this moment. How do you qualify that my feeling of beauty comes from feminine? How do you quantify that as this is a woman's way to feel beauty, and this is man's way to feel beauty, and this is non-binary way to feel beauty? So what I want to say is that this idea, I feel like women, I feel like we have so many books written on it, but they're all meant to mislead us. I feel like there's so many books. Men are from Mars, women are from Venus, and women feel more emotional, and men feel more this and this. And I think we all have been sold an idea of separateness. In my experience, human beings feel and experience emotions that are genderless, but then we tend to cloud them and shroud them and dress them up with our personal experience. But emotions initially are genderless. And so I think it's important to also think about it, because I have a lot of clients who say, I want to feel like a woman. And it's like, well, what does it even mean? Like, if you identify as a woman, if you identify as non-binary person, if you identify as a man, then you, through the form of your self-identification, you're going to start navigate life through that embodiment. And you're going to start accumulating experiences that are going to be subjectively revolving around that. And so there's going to be a perception that I'm experiencing a world as, and then there's also going to be an experience, right? Because there's perception of me experiencing my emotions as a woman, and then there's certainly are experiences out there that where world experiences me as a woman, and therefore also further dresses up my subjectivity. So I just want to point that out. I think it's kind of more a complex and complicated subject, but I have a lot of people who ask me, when do I know I feel like a woman? You probably already are, you know. And a lot of us are chasing that feeling when we already have it inside of us. Now, your emotional desire for this internal state of being is fluctuating, because sometimes, as you say, you're very comfortable with your assigned gender, and some other days it really varies to a larger or greater degree. There could be possibilities that the reason why there's fluctuation going on is because you are more inclined to gender fluidity. You're more inclined to navigate the world, sometimes from internal orient of femininity and sometimes from internal orient of masculinity. It also could be that you are more trans femme than you actually realize, and the reason why there's no physical dysphoria is because it's still dormant. That's also a possibility. I'm reading your question here. And yes, this barrage of emotions does vary in degree. It can vary also very drastically, where one day you feel very strongly seeing and resonating to yourself in one way, and another day is something else. It can fluctuate very, very drastically. You're basically describing fluctuations. But I do want to again encourage you and everybody else listening, this discussion about act and feel totally feminine. Now, act is something else. Acting, the external behavior, we can actually quantify what that is. What does it mean to act feminine? That quantification of what it's like to act feminine in regards to behavior is going to be further inundated by social constructs of what a woman, how a woman's supposed to act like, how a woman's supposed to behave. So there is a way to imitate that social construct as much as it relates to today's not understanding, but today's gender markers of femininity. But to feel totally feminine, yeah, it's it's feeling is, if you're in a moment experiencing something, and if it's something gender specific, that would be an interesting video to actually make on this feeling. What does it mean to feel like a woman, right? I'd love to hear what everybody else thinks about it, because feelings are so elusive, and feelings, again, a lot of emotions we feel are not gendered. But then there's behaviors that elicit feelings that then we subjectively cluster as feelings. So hopefully this helps you. But yes, very, very common for emotional gender dysphoria to fluctuate that much more. And when you also throw any shred of physical dysphoria to the mix, it will amplify that or just fluctuate even more frequently. Very, very common. Great set of questions. If you have question for me, comment below. Share, let me know what you would like, what subject tend to kind of each inside of your headspace and you want to answer on. And I would love to take my shot at answering and clarifying them. I can't even speak. I did so many videos today I cannot speak. I need to take a little break. So having said that, hope all of you have a wonderful day, and I will see you next time. Goodbye.